Welcome. NSG 515, Study Section 5, Roles of Nurse in Emergency Care. In this study section, you will be discussing the roles of nurses in emergency care. You will begin with an explanation of emergency nurses. You will continue by highlighting the positions available for them, under which you will describe the transport nurse, the triage nurse, and the attending nurse. Subsequently, you will discuss the roles of an emergency nurse. Learning outcomes. When you have studied this section, you should be able to describe the emergency nurse. Emergency nurses. Who are the emergency nurses? Have you seen one before? Let us start this discussion by saying emergency nurses, EN, are nurses providing specialized care in an emergency situation. Emergency or nursing, also known as the emergency room nurses, are usually registered nurses with specialized training and education. Many supplement their training with certification in specific areas of emergency health care. To become an emergency nurse, a person must have an associate degree in nursing, Bachelor of Science degree, or a diploma from a hospital with a nursing program. Lewis X. et Kemper M. 2010. Emergency nurses provide rapid assessments and treatments to patients at the initial phase of illness or trauma and often in life-threatening situations. Emergency nurses usually hold an undergraduate degree in nursing and most often work in hospital emergency room and trauma centers. As an emergency nurse, you are exposed to many positions. Some of these positions are discussed below. Types of position for an EN. Transport nurse. She rides with and treats the patients on the way to the hospital. A transport nurse rides in an ambulance or helicopter to the scene of the accident or the location of the patients. The nurse helps the emergency medical technicians move the patients to the emergency vehicle and tend to the patients while they are in the transit to the hospital. As the transport nurse assesses the patient's condition, she takes vital signs, speaks to the patient, if possible, and the family, and works to stabilize the patient en route to the hospital. On the way to the hospital, the transport nurse continues to monitor the patient's condition and is in communication with the staff at the hospital so that they can be prepared to continue treating the patient once he is brought into the emergency room. Triage nurse. She is the first medical staff member a patient sees in the emergency if the patient is not in a critical or life-threatening situation. Patients who walk into the emergency are good candidates for the triage nurse. The triage nurse meets with the patient to assess and determine the patient's medical needs and the level of emergency. Susan C. and Brenda B. 2008. In order to do this, the triage nurse asks questions about the patient's symptoms and medical history and also takes vital signs and observes any physical signs of the illness or injury. Once the triage nurse has finished her assessment, she informs the emergency room staff of the needs of the patient so the patient can be treated in the manner and time frame warranted by the condition. Attending nurse. Once the patient is admitted into the emergency room and stabilized, the attending emergency room nurse checks the patient's vital statistics, speaks to the patient about their injury or illness, and provides basic treatments while waiting for the doctor to see the patient. In a critical situation, the emergency room nurse works under the direction of the physician to set up medical equipment and assist in life-saving procedures. When the patient is stabilized, the emergency room nurse assists in preparing the patient to be moved to a hospital room or ward. Roles of an emergency nurse. The roles of an emergency nurse can be classified as follows. Independent role. The nurse provides care independently based on her educational preparation and hospital policies. Dependent role. These are prescriptive activities carried out by the nurse. The activities are most times prescribed by the physician in charge. Interdependent role. The nurse works with other healthcare providers to give quality care to the patients. Study section summary. In this study section, you learned that emergency nurses (EN) are nurses providing specialized care in an emergency situation. EN, also known as the emergency room nurses, are usually registered nurses with specialized training and education. Many supplement their training with certification in specific areas of emergency health care. To become an EN, a person must have an associate degree in nursing, bachelor's of science degree, or a diploma from a hospital with a nursing program. End of study.